Welcome to the office. Hi, Nikki. Welcome to the office.
Thank you.
Nice to see you.
You too.
Where are you coming from?
San Diego.
What are you doing here from San Diego?
Here to see you. Because you're the best.
I don't know about that, but why?
Well,
How did you hear about us?
I have a friend who actually talked about Gonstead years ago.
Okay.
And I, saw someone in San Diego and it helped. And that's when I learned I have
Curvature in your spine?
curvature. Yeah, we won't say the word.
Okay. The S word.
The S word. So I've just had it in my awareness, and then I'm a very active person, like 4 or 5 days a week working out with whatever, weights, Pilates, yoga. So because of that, I feel like because I'm so hard on my body, just as of late, within the last couple months, I'm noticing more aches. Things are achy.
Achy or sharp?
More achy.
Sore?
No, because
Achy.
I know it's sore. Sore muscles after you work out, that goes away. This
Achy
is
doesn't.
chronic. This is sticks around.
And where are you getting it?
My right wrist,
Okay.
my right knee,
Okay.
my right ankle,
All right side.
and then low back.
Across the whole low back? Or
If I try to do deadlifts, squats with the bar on my back, game over. I push through, but it's.
Can
doesn't
you
feel
do
good.
something else besides that?
Besides weightlifting?
No, besides putting a bar on your back?
Well, yeah.
Because, we'll talk about it.
Okay.
Okay?
I know I'm probably going to need to shift certain things.
Yes. Okay, but look, you're coming from San Diego.
Mm-hmm.
It's not just, it's a couple-hour drive. So it's not like an easy thing, I know, to come and you got to plan the trip. So
I
to
do.
speak, okay?
Yeah.
So you were achy, sore, you were getting some care, you got some result.
Yeah, I mean,
Okay.
neck stuff was happening a lot more then. I would wake up with neck pain every morning, and I don't know if it was pillow or whatever, it just wouldn't go away. And then I started to see him, and he helped with that.
Okay.
So
So the neck was doing better.
the neck's better.
Okay, and out of everything, what's number one? What's the number one issue? It's all right-sided, just wrist.
Yeah, it's right.
Knee,
I don't.
hip.
It would probably be my tailbone and low back
Okay.
if I had to pick something, because I like to do my workouts.
Okay.
I like to do heavy lifting.
Okay.
'Cause I don't like not being able to do it.
You ready to go over your x-rays?
Let's do it.
Let's do it. Let's go over your x-rays. Let's explain what's going on.
Okay.
From there, we'll examine and figure out what we're going to do, okay?
Do you see this often?
What's that?
Curvature.
A lot.
Do you?
And I see a lot of it related to tailbone injuries. And there's the difference between a structural, if you want to use the S word, the scoliosis, there's the structural one and there's a functional one. Structural one is the bones have changed shape. That's a management issue. That's not I'm going to fix it. Okay? Versus a functional one, due to nerve pressure, due to misalignment, causes some muscles on one side to become weak, the others get tight, and it creates that curve.
Okay, I see.
Okay? Now, let's go over this. When we're looking at this x-ray here, the first thing we want to know is this, before going over structure versus function, we want to know compensated versus decompensated. Compensated curve means the body has already made all its compensations. There's nothing to change the physical appearance.
Okay.
Decompensated curve means that it hasn't fully compensated yet. And the way we measure it, we're running a line from the sacrum, the center of the sacrum here. We're running it straight up. And if it bisects the dens of C2, which yours doesn't, your dens is right here. So that's good news. The dens is here. If these two would have lined up, I would say that's a compensated curve. There's nothing to change the physical appearance regardless of whatever you do.
Wow.
Yours is a decompensated curve. So that's the first good news. Okay? Let's continue. Does that make sense?
Makes sense.
Okay, let's go down now. Now, when we're first looking at the hips, there's a 5 millimeter measured difference on the left side, so the left is slightly lower than the right side. That 5 millimeters could be coming partially from the tailbone. We have a drop sacrum on the left side, 5 millimeters. We have a tiny bit, there's not a lot of rotation of the sacrum, so I'm not worried about that part.
Okay.
It's the fact that it's dropped down and the hip is dropped. So both of these two things together is what started this process. College?
No, I had
Sport?
I had a tailbone thing when I was a kid. Like I remember hitting it.
What did you do?
I was like on a swing, and I went under the swing, and there was a rock right there.
Ow.
And I slammed right into it.
Ow. And you remember this?
I remember that.
How old were you?
Oh, between maybe 7, 8.
Let's look at the tailbone. Now, when we look here at the tailbone, this is the sacrum. It's got a sharp, you can see it better now. It's got a sharp curve.
What's a normal one look like?
I'll show you on the baby one, but the shape is the same.
Okay.
Okay. It's like this.
Oh.
Yeah, so you
no
you almost have a
way.
right angle.
That's gnarly. When you put it like that,
Look,
yo,
here's the adult spine.
get out of here.
Mira.
Are you joking?
So, it comes like this. This is the sacrum. This is the coccyx. This is the sacrum. The bend is here, but you have 1, 2, 3 segments, and then you get there. The coccyx, you have 1, 2, 3 segments, and then you're there. You broke it right there. Okay?
This looks so painful now. I can't even look at it.
Okay, so this is what started this whole thing.
Yeah.
How old were you again?
Probably 7, 8.
7, 8. And this was where? San Diego?
I'm from Hawaii, so Hawaii.
Hawaii. Okay. All right, so part of the fix here is we got to see if we can get any of that fixed for
Okay.
you. Okay, that's kind of important. So the sacrum needs to go up, but before that, it's coccyx work. That along with the EX pelvis. Why? Let's talk about the pelvis. The left pelvis goes up 1 millimeter, not so significant to me here, and goes out EX. So the whole foundation is doing what? It's favoring to the right side. So you're always favoring it. Now, you're doing squats, deadlifts, any of that, your left always goes down first. So you have to compensate your hips or your feet in order to balance it out.
Wow.
Does that make sense? Okay. Tailbone and left pelvis. Those are the majors, okay? From that, it created this curve, yes. We have some of this, we call this flailing of the ribs, little calcification at the ends of the ribs. Whenever I see that, I tell the patient to check their thyroid.
Oh.
Okay? Thyroid, I talked a lot about this in previous videos, but basically, we have to rule out thyroid, parathyroid, okay? Because this is related to the calcium regulation in the body. Calcium, 2.5 calcium, 1 phosphorus. We want to see what that ratio is, but before we look at the ratio, we want to see, is the thyroid doing its job? So whenever you get your blood work, just bring it to me, please, okay? Let's continue up. So these bones are fine. These bones are square, good, good. Bones are all good, good. Now, this one is starting to change shape. This is starting, this one is not. So it's 1, 2, these 3 segments. So the idea is with whatever we do in the foundation, there's going to be a lot of other work you may need to do in terms of body work. I'll talk about that stuff later. And it's not just getting a massage.
Oh.
It's a little bit more, it's a little deeper, a little more aggressive than that. And it's not something I do, but I'm going to recommend it for you down the road. Okay? And I'm pretty sure you can handle it. If we're looking at the numbers, this is 12, 11, 10, 9, 8, and 7. 7, 8, 9, those are the 3 that have started to change shape. There is a possibility, depending on what we do in terms of the work and what we decide to do down the road, that things level better, but this is the part that's going to always need attention.
Okay.
Meaning back strengthening.
Can I ask another question?
Yes, please.
My shoulders are starting to turn in. What's that from?
Rounded shoulders.
But why?
That's posture. Now, let's go.
Weak back muscles?
Weak lower traps.
Oh.
You know lower trap exercise?
Well, I would never guess that.
It's the one exercise. Come over here. So the lower trap muscle, this is the trap, it comes to here. So this muscle, the lower traps, is one muscle that's overlooked in a lot of people that work out.
I've literally never heard that being called lower trap.
Lower trapezius muscles.
I know this is your trap. People point to this
There's 3
one.
parts. So there's 3
That's
traps.
crazy.
There's upper, middle, and lower. There's 3 parts of the trapezius muscle.
I don't think I knew
The
that.
lower trap muscle, the way you work it out, you're basically on the bench or on the floor.
Okay.
V shape, and you're doing these.
Oh, okay.
I'm sure you've seen people at the gym doing them.
This bothers me a lot.
Yeah,
It's
so
not from the spine?
well, it's that too.
Okay.
But it's starting here. If we're talking about foundation, what are the things you can do? You're going to work lower trap muscles. And there's a video I have called Flossing for Your Shoulders. It's 4 basic exercises with a yoga ball.
Okay.
4 basic. You do it before every workout. Takes 3 to 5 minutes.
Okay.
Okay? The other part of the rounding is because of this. We get more curve in here. We get a little curve in here. Right now, it's just a sway back. Straight spine. We need more curve. We need to focus on working these curves, getting more curve in your low back, getting more curve in your mid back so that your neck can be where it's supposed to be. As long as this is straight and as long as the upper part of the body is behind the foundation, like this, there's always going to be something going on.
Man.
Okay? No, you can do it. You can do it.
Okay.
No, seriously, you can do it.
Okay.
It's just going to be a little extra work and different workouts.
Yes.
Okay?
That's what I need to know.
Strengthening, but different things that need to be strengthened.
Okay.
Let's continue. Upper cervical jaw TMJ. We got some jaw issue going on. We have deviation. Is there any pain in the jaw?
No.
Then we don't touch the jaw. So 2 things we don't touch: asymptomatic knee, asymptomatic jaw. We're not touching the jaw. How about the nose?
I mean, it doesn't bother me, but I can't breathe on one side.
Okay, so right side, left side?
Right side.
Okay, so we'll take a look at the septum as well. Cool? Questions?
No, this is great.
All right, we're good. Let's go ahead and get started. First thing, let's do the visual. When we're looking at the visual, what do we see? Little puffiness of the tailbone here. That's what we want to work on. You can see the spine. There's a little bulging there. That's inflammation. It goes up. You can start to see the curve. You can see that she brings this side back. So we want to see also if we can get this right side forward. So your shoulder here is actually starting from right there. Okay, as we go up, there's another little dip in here, a little kink in there. March in place, knees up high. I'm just watching her balance as she's walking. So we said there's a slight lower leg on the left side. When she plants the left leg, it's fine. When she does the right, there's more instability. The other thing we can see is the right knee rotates out a little bit more than the left. Walk to the corner of the room, please. And just regular walking back and forth. Just keep going. As you're walking right now, Nicole, what are you feeling off the most?
My right knee.
Okay.
My right ankle.
Mm-hmm.
Like, I don't feel anything on my left. It's just...
It's all right.
Right, yeah, it's all right for me.
Okay. One more time. Walk on your toes now, please. Let's watch the dimples there and see. Yeah, that right hip's not moving. Turn around. Walk on your heels, please. And we can see right under the bra line there, it's very stiff, and she oscillates back and forth in the spine. Regular walking, one last time. Awesome. All right, showtime. Have a seat. All right, let's scope you out, starting at the base of the neck. Let's see what we find. And the first thing we're getting, 5 points, C6, C7, left side. Tiny bit up top, right side, 6 points. What's up in San Diego?
What?
Work, family, life.
Yeah. Family life. Just been there for so long now.
Okay. T6, 3 points, right side. It's a tiny one. S4, left side, 8 points, 10 points. S4, S5, T6, C6, C1. Next thing we're going to do is static palpation. Head down, please, running my fingers down the spine. And what we're looking for in static palpation, we're looking for that swelling and edema. And what we can see as I run my fingers here, this is okay, it starts there. I'm looking at that pooling of edema right there, and it goes in right at that 6. But it continues. We get a little bit of that orange peeling effect, and that's from inflammation. 7, 1, 2, 3, 4, 5. Tender there?
Yes.
Or there?
First one, that
6. Follow it down the spine. You can see it go. Still there, all the way down. And you can see I'm going towards the left side. I'm going towards the right. So all of that edema in there is the body's way of trying to stabilize instability. Let's check the movement of your hips, feet together. Open and close are your feet touching the ground?
Almost.
Cool.
Okay.
Open and close your knees with your feet touching. Right side only. So when you do the right, the left shifts a little bit with it from fixation. Do the left side only. When she does the left, the right goes too, but not as much. Do the right side again. Do you feel that? When you're doing the right, my thumb on the left is shifting with it because of the fixation. It's stuck. Now, do the left side. You see this side isn't as stuck. It's moving. So while you're still feeling the pain there, it's not from there. It's the right S4, S5. It's the left pelvis. Scoot back for me, please. Let me show you. Back slowly in extension. 5, 1, 2. That's tender.
Yeah.
3, more tender. 4, 5. I'm going to be on the outside, okay? Right there.
Oh, God.
That's it.
Oof.
Okay, that's the one.
Woo! Oh, my God.
Feel that side. Not as bad.
No.
It's coming from right there.
Yeah.
Okay. Left hip, right coccyx, T6. Sit back for me. Let's grab the bun a little bit. 7, 6, 5, 4, 3, 2. And let's check 1. Bend right, bend left. That's the right side. Right C1, C6, T6, left pelvis, coccyx. Open the jaw slowly, open, open. Close, slowly open. Little shift. There's no pain in your jaw, correct?
When you're pushing on it.
Otherwise, there's no jaw.
No, but I feel like sometimes it just kind of, one of them locks up a little bit.
Slowly open. Right opens, left goes. It's the right. Right there. We'll work on that as well, okay?
Okay.
Right septum, left septum. More tender there, more tender there.
I mean, now it's the left, but I know it's the right.
Yeah.
Why?
It's shifting. We got to do double whammy today. Okay, here's the game plan for today. Game plan.
Okay.
Low back, pelvis, coccyx, T6, C6, C1. After that, we're going to work on the right ankle,
Okay.
jaw, and nose. Ready? You ready?
do it. I'm ready.
Let's do it. Left side down. The Cobra's back. Slide forward. Nikki gonna get the Cobra. I'm holding firm. You okay there? I got you. Let it roll. Got you. Stand up and walk it out. Let's go right side down. Now in her scenario, it bends pretty hard there, bends in. So what I'm doing is I'm actually bringing it out. Okay? Gotcha. That's the home run. Booyah. Walk it out. Good? Face down over here, please. Tender.
Yes.
Tender.
Oh, yes. They're both. The left is worse.
Slide up. But you were saying everything was right, remember?
I know.
We'll check it at the end. T6. T6, we're going to set 1, 2, 3, 4, 5, 6. 1, 2, 3, 6. Gotcha. Gotcha. Hi. Six on the left hand up. Let's use the stabilization strap just to give you a little stability. You okay with that right there?
Sure.
Heading down. C6. And we want to lift. Up. There you go. And C1 on the right. Clunk. Perfect. Beautiful. Walk it out. That's the home run, lady. Tell me.
We did a lot.
One more time, and then we're going to do the pelvis.
Okay.
So for her
that was so
pelvis, her EX is the major, okay? So the EX pelvis is the major of the misalignment. The book says, with the EX major, to pull it. However, she has a convexity, or the high side of the rainbow is on the right side, on the left side. We want that side up. So this would be an alternate to what we would typically do.
Oh, wow.
Go right side down, please.
Okay.
And we're going to push the EX. So for the EX push, we're right on the PSIS there. I'm hooking it this way. Bring the elbow out. Hold your wrist, please. And we want to push the EX in. That elbow needs to come out a little more. That's a piece. Little more. That's not it. Come up slowly. I'm going to be here on the glute, okay?
Okay.
Slide up a little bit. I'm holding the left. Sorry, I'm holding the right, pushing the left this way. You good? Gotcha. Walk it off. As you're walking, tell me what's different. Take a couple of strides. Hi.
Hi.
What's different?
I mean, right away I'm just always like floating.
Turn your head to the left. Look to the left. Look to the right. Good.
So good.
Keep walking. Okay, have a seat back over here. Let's rescope you and continue. Neck is clear. T6 is clear. Scoot back for me, please. Low back is clear. Check it out. Check it out.
No way. What?
I'm going low. Muscle. That's muscle.
Okay, because that's, yeah.
It's not that
Still
same
nothing
sharp.
like, yeah. Is that a muscle?
This is,
Okay.
yeah.
Okay.
I'll work that out at the end.
Okay.
Okay, spine is clear. Go on your back, please, on this side. Now the fun part, we're doing the right ankle. And the way we're gonna do it, can I have you take your socks off, please?
Yes.
So, this is what we're working on now.
I will say my ankle clicks when I wear higher heels. It'll just click, 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 and I can make it click anytime.
Got it. That's ligament.
Okay.
That's the ligament or tendon running over a misaligned bone.
Okay.
Bring your toes back as far as you can, please, all the way back. Relax there. It's actually your left, too. You feel that?
Yeah.
Or that one more? Both of them hurt?
They're both.
But which one?
But the right clicks.
Which one hurts more?
Right now, can you do one at a time?
Sure. This is the left.
Okay.
This is the right.
Okay.
This one is more stuck, but this one also hurts.
That one hurts.
This one hurts, right?
But maybe because I've never, I don't know.
You've been favoring.
Yeah.
Okay, we're going to work on both. Can you deal with it?
I mean, I
As
get
much as you can handle. If it's too much, I'll slow down, okay?
No, I can handle it.
I'm working the scar tissue. This is periarticular swelling. We're working the swelling away from the joint. We're trying to equalize the joint pressure. There you go. Next is going to be passive range of motion, web contact on the dome of the talus. Listen to this, come here.
I told you. I know.
That's coming from there.
Oh, oh my God.
Watch this. I'm on the posterior tibia. Bear with me, okay? Let's figure it out. Less? Mm-hmm. Tibialis anterior and peronei. Posterior tibia.
Oof.
That means I got to do the knee. Turn on your tummy. You asked for it, right?
I guess. Wait, like this?
Yep. I'm going to work on the right knee. So, same thing, we're going to work on the swelling and inflammation. Bring this out. If it's too much, you tell me, I'll slow down. You feel that bump right there?
Yeah.
Hold on to the table there, please. Up top. There you go. Nicole, if it's too much, you tell me, I'll stop. 4, 3, 2. We're doing a posterior tibia or a PEX tibia. External, posterior on the external side. Right now we're working out the inflammation and the swelling in the lateral capsule. Right there. I'm going to hold there. Hold on to the table, please.
Yeah.
Bend the knee. So we're right there on the lateral aspect of the tibia, superimposed with pisiform. You're good? Mm-hmm. Clunk. Gotcha. Turn over.
Is that why you said hold on?
Yeah, turn over.
Oh my gosh.
All right.
Oh my gosh.
You asked for it. You know.
Oh.
4, 3, 2, 1. Okay.
Is that an injury thing? Look, but the behind the knee thing, like.
Those are old injuries. Talus, AS talus, medial tilt. Ready? Right there. AS talus, medial tilt. Perfect. Sweet. Other side. Raise it up. 5, 4, 3, 2. Equalize the joint pressure. 5, 4, 3, 2, 1. AS talus, medial tilt. Nope. Let's do the board. Walk it off. And then we got the nose and jaw. Walk it
Does it
off.
ever end? Does it ever end with me? Oh my gosh. Oh my gosh, I feel so amazing. Oh, it feels so much better.
That's different. Walk on your toes now. Check it out.
Oh my gosh.
That doesn't mean you wear 6 inches, okay?
No, I think those days are over. It's
going-
not clicking anymore.
What's not?
The ankle.
Seriously?
I couldn't do that without it clicking.
Cool. On your back.
Okay.
Nose job. That's the right. I'm feeling it there on the left today.
I know, right? Why?
Feel that.
Yeah, that
That's
sucks
good.
too.
We're going to do both.
What?
Can you handle it?
Just,
Do
yeah,
it.
just, you know
Vamos.
what? Whatever.
Chin down. We're going to do the left side first. That's it. Now the right. There. Got it. That's it. Deep breath in. Deep breath in. And out. There you go. Sit up, please. Last one. The jaw. Sit back for me.
We're really just getting it all done.
Are we
We're
good?
banging it out today.
Are we good?
We're good.
All right, I just want to make sure.
I'm a champ. I just have to say.
Look up. Open. Slowly close. Slowly open. Right side goes first. Left side compensates. We're going to do the left EXTMJ. Open all the way. Close halfway and hold. Hold. Applying pressure left to right. There it is.
Oh my. Woo.
Open. Voila. Mic drop.
Mic drop.
Walk it off last time.
Can I mic drop too?
You
'Cause,
can mic drop.
I mean, let's be real.
That was a mic drop.
Ah.
Talk to me.
Whoa. Okay. Whew. I just feel like I'm a new person.
And no weights, we said a couple of days, right?
Yeah.
Cardio, hardcore.
Yeah, you told me that.
Have a seat. Did you listen? Right shoulder. Ears. Stand up and let's do the elbow and wrist. Squeeze. 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 Elbow. Posterior ulna. Posterior ulna. Posterior radius. Posterior lunate. And the interesting part of this, not a lot of cracks in there
Wait.
because it's coming from your neck. A little more. There. Squeeze. Good. Squeeze. Elbow. Wrist. Questions?
Yeah, I probably do, but I can't think right now.
Okay. You ready for the journey now?
I'm ready for the journey.
Okay, we have a few visits. Let's figure out kind of how to get you back in balance.
Okay.
Then I'll give you better recommendations.
Amazing.
Welcome to the office.
Thank you so much.
You got it.